Thanks, Greg. Good morning, everyone. Thanks for joining us for this morning's Knock Out Opioid Abuse webinar, COVID-19, Behavioral Health and Addiction. Today's webinar is brought to you by the Partnership for Drugs in New Jersey and the Horizon Foundation for New Jersey. The Horizon Foundation for New Jersey, along with Horizon Blue Cross Blue Shield of New Jersey, has been collaborating with the Partnership for Drugs in New Jersey on a 2-year Knock Out Opioid Abuse initiative to address the opiate epidemic through community outreach, prescriber education, parent education, and a statewide awareness campaign. In light of the current pandemic, this initiative has expanded its offerings to include this webinar series to help continue the conversation about the opiate crisis as we all navigate through this difficult time. To deliver some opening remarks on behalf of Horizon Blue Cross Blue Shield of New Jersey, I'd like to introduce Suzanne Kunis, the Vice President of Behavioral Health for Horizon Blue Cross Blue Shield of New Jersey. Thank you. Welcome, Suzanne.
Thanks, Angela, and good morning, everyone. It's my honor to join you this morning, and I would like to thank all of you for your interest and attendance today. I know this is a very challenging time for everyone, and we greatly appreciate your dedication to continuing the discussion on how we knock out opioid abuse in New Jersey, especially during this critical time. As many of you are aware, due to COVID-19, the Partnership for a Drug-Free New Jersey has postponed the scheduled in-person spring town hall events until the fall. The Horizon Foundation has been working with Partnership to develop ways to continue the conversation and community engagement through social media and through the Partnership's website. The Partnership team has quickly adapted by planning a series of webinars centered on how the pandemic will impact the opioid crisis. Today's webinar, COVID-19 Pandemic and the Trauma Impacting Our Children, is the 4th in that series. Horizon, through its philanthropic arm, the Horizon Foundation for New Jersey, is extremely proud of our collaboration with the Partnership for a Drug-Free New Jersey to bring you today's webinar through the Knock Out Opioid Abuse Initiative. This initiative is part of our company-wide response to address and help end the public health crisis across the state, and represents a large portion of the Foundation's $1.3 million we've invested to provide support for opioid prevention and education programs to help families and our members. In closing, I want to thank Chris and David for presenting today, and to the Partnership for a Drug-Free New Jersey for putting together this very important webinar. Together, we can make a positive difference in combating this epidemic. Thanks for your participation today, and I will turn the meeting back to Angela.
Thanks so much, Suzanne, and I want to thank you for your participation today, but also for all of the support that you've provided this initiative over the past 3 years at so many in-person events and trainings, and just the support that you've provided, so thank you. As Suzanne mentioned, today's webinar is the 4th in this series, and we're happy to have with us today Chris Barton, Director of Integrated Systems of Care and Network Innovation for Behavioral Health at Horizon Blue Cross Blue Shield of New Jersey, and Dr. David Bush, Medical Director for Behavioral Health at Horizon Blue Cross Blue Shield of New Jersey. To lead today's discussion on this very important topic, I'm going to now start by turning things over to Chris. So Chris, thanks so much.
Thanks, Angela, for that introduction, and good morning, everybody. Thank you for joining my colleague David Bush and I to talk about the impact of COVID-19 on behavioral health. I'm going to start by telling you about Horizon's role in the behavioral health service delivery in New Jersey, and explain a little bit about why we are where we are today in terms of our behavioral health operations. Oh, and by the way, when I say behavioral health, when we talk about behavioral health at Horizon, we're talking about both mental health and substance use combined. Right. I want to start by telling you a little bit about some of the challenges that we've identified that are impacting behavioral health service delivery in New Jersey. Several years ago, Horizon began to take the necessary steps to adopt a fully integrated model by bringing behavioral health services in-house for the first time in Horizon's more than 80-year history. In that process, we identified these challenges that impact our service delivery system. The first of these is stigma. People fear that they will be treated differently or treated badly, perhaps, because of their need for mental health or substance use disorder treatment, and that discrimination impacts the ability to ask for help and access care. Physical health and behavioral health exist in two very different fragmented care delivery systems, and there is limited coordination between behavioral health and physical health providers. This causes disjointed care delivery and higher total cost of care. Number 3 is the limited holistic member treatment. Even within behavioral health, there is dichotomy. Mental health and substance use treatment have historically been separate service delivery systems with very little crossover. So providers either focus on mental health or substance use treatment, but often don't treat both conditions at the same time, even though half of the population experiences both of these conditions. Number 4, there's an access and capacity concern. There's a national shortage of clinicians, beginning with LCSWs and LPCs, straight on up to medical doctors who practice psychiatry, and all of these providers are in high demand. They're being recruited by treatment providers and by managed care and health plans. This kind of personnel strain limits capacity and consumer access to care. Number 5 is increasing out-of-network utilization. Some members are fortunate enough to have plans with out-of-network options, but they also are more vulnerable to some of the scams that we're seeing in the news, including patient brokering and some of the more unscrupulous things that happened, particularly in substance use treatment. When members use their out-of-network benefits, health plans don't have any influence over those programs, no credentialing or quality monitoring. There's very little oversight, and that can become a problem for members and for the health plans. Number 6 is the opioid epidemic. This has been a huge focus for health plans, not just for behavioral health, but also for medical and pharmacy departments. Horizon has an internal work group that is constantly looking at opportunities to raise awareness and to bend the curve of opioid use and abuse. Number 7 is information capture and sharing. Another challenge that we've experienced is that data can't often be shared between physical health and behavioral health providers. There are some extra protections for behavioral health data that limit the ability to share. That limitation makes it harder for physical health and behavioral health providers to work together to collaborate in care for our members. There's also challenges with transparency around clinical outcomes, or perhaps providers can tout their success rates, but there's no standardized rating system or no STARS system that can tell consumers whether this is a quality clinical program or not. And finally, there's been a lot of complex legislation over the past few years in the New Jersey SUD mandate and the Mental Health Parity and Addiction Equity Act, both great pieces of legislation in terms of increasing access to care, but also very complex legislation that add hurdles and process on the plan side that we've had to deal with. So those are some of the challenges that have impacted where Horizon has been implementing behavioral health in New Jersey, in insourcing behavioral health over the last couple of years. But we've taken these things into account, and we have built them into our plan for behavioral health service delivery. And there are 3 components to this. We've developed a continuum of resources that meet the needs of members where they are. We have intentionally integrated behavioral health and physical health through the insourcing of our behavioral health services this past year, and we have been working on developing an integrated system of care. Let me first talk about numbers 2 and 3 on this chart and tell you about our integration efforts first. Horizon began an almost 2-year process of moving outsourced behavioral health services that were formerly contracted with Magellan or most recently with Beacon Health Options to inside Horizon. This meant developing all kinds of systems and processes that had been outsourced for more than 30 years and hiring about 400 staff. All of the government business, meaning primarily Medicaid and some of the specialty programs, were insourced at the end of December in 2019, and the commercial business was insourced in March 2020. And that means that behavioral health business at Horizon is just about 2 months old now, and doing great during a very difficult transition time with all that's going on in the world. The second part of the integration is a special project called the Integrated System of Care, or the ISC for short. This project seeks to help our members with serious mental illness and substance use disorder access and engage with physical health providers to address their physical health needs. Sometimes this is just basic routine health care that may have fallen by the wayside. Other times it's chronic and sometimes even acute physical health needs that have been unattended. The behavioral health provider sort of quarterbacks the care and advocates for members in the physical health space and also works to address some of their social needs. It's a great project and we'll be looking forward to some expansion over the coming months. And then finally, back to the continuum of care. I'm going to flip to the next slide. Our continuum of care really has been intentionally developed to meet the clients' or members' needs where they are. This is a primary focus of over the last few years. And if you look at the arrow across the bottom of this chart, you'll see the severity of the behavioral health condition from low to high. And we've developed specific interventions to meet members where they are on this continuum. So if you look at the low end of the acuity, you'll notice that this is a focus on whole health and wellness. Here we have prevention and education programs, some member access to information and resources, and employee assistance programs. Moving one step to the right, you have programs for members with mild symptoms. Interventions here are focused on self-directed care services that the members can access on their own to deal with depression and anxiety, and include some computerized cognitive behavioral therapy for those with mild to moderate symptoms. Moving one step to the right, you see the group of people who are in rising risk. They're experiencing symptoms that are beginning to interfere with their lives. At the bottom of this chart in the rising risk category, you see a green box called Core Behavioral Health Services. That is the network of over 6,000 providers that serve Horizon members. Everything from outpatient therapy and outpatient programs to more intermediate care, IOP and PHP, and straight on up to acute care and residential treatment. But also in this rising risk category, you see collaborative care. That's the integration of physical health and behavioral health. We have a provider that helps to coordinate and bridge the gap between the two. We have a variety of telehealth solutions and even a virtual therapy and coaching program. And moving again one step to the right, there are more intensive interventions for substance use disorder, including medication-assisted treatment, some peer support programs, and that integrated system of care program that I talked about a little bit earlier. And more to come in the area of severe mental illness as we move even one step further along in this chart. But just wanted to give you a picture of some of the work that Horizon has been doing in the background pre-COVID-19 to prepare the behavioral health system. And interestingly enough, has been a great resource as we have had to go virtual for behavioral health in the last few months. And with that, I'm going to turn it over to David to talk about some of the clinical implications of COVID-19 on the behavioral health community. David?
Thank you so much for the opportunity to present today. It's a real honor. We know that the coronavirus, has had a tremendous impact on all of us. So we're going to talk today about how it's affected people in general, but also some details on how it affects those of us with a mental health diagnosis, those of us with a substance use diagnosis, and there's clearly an overlap between the two. And we'll talk also about people on the front line, our essential workers, our frontline healthcare workers who do wonderful work, but also are having a good deal of stress with this. So I'd like if we can move to the next slide, please. Okay, so this is a great slide talking about, the common things that we face. And what I'd like to talk a little bit about is what's happened to us with the virus, talk some about the different illnesses that are worth treating so that we kind of know what would tell me that maybe I've got something that can be helped. Because what we're trying to do is have people reach out, ask questions, connect, and Horizon's making a big effort to be able to help people connect, find the right program for them, find education. So at this point with the virus, we're all stressed. Uh, many people are laid off. Many others are working from home. At home, many people, have a whole family together without too much space, without too much break from one another. There are economic stresses as so many people have been laid off. There's no place to vacation. You can't go out for a cup of coffee. There's a lot of tension and fear of getting ill, fear that the people we love are going to get ill, fear that I'm going to catch something and then I'm going to give it to the people I love. People are worried about their job and getting back to work. People are struggling with finance. Many of our members are dealing with being alone, not seeing friends and family. All of us are affected by that. Canceling plans, in some cases having to make significant life change adjustments, like the person who was about to, say, buy their first home. There's sadness, grief, because we've had losses. We feel helpless. We'd like to be able to say this is controlled, but we can't. Anxiety about the uncertain, anxiety about what could happen next, anxiety about will there be something bad dropping in on us that we didn't anticipate. Remembering that 6 months ago, none of us was thinking anything about this. There's going to be, in this kind of situation, as there's been in other pandemics, an increase in clinically significant depression and anxiety. 25% of people in other situations like this have identified themselves as depressed. There's an increase in drinking and other self-medication at times like this. There's an increase in family pressure. I'm sure I'm causing more stress for my wife being around all the time, but it gets really significant sometimes. There's definitely a risk of increased domestic violence and other family issues. There's issues for children as well. There's an increase in prescriptions for medication, such as anti-anxiety, antidepressant medication, but I would advocate that medicine alone is often not sufficient, that what we need to be doing is being in touch with others. And that's, again, where Horizon can help by helping people to connect, either with a virtual community or with people you can actually call. A great lot of those of us who are in clinical work are wanting to connect via telehealth, and there's many programs that are not available. The federal government has relaxed some of the regulations, and it's good to connect. I know a lot of people have been reluctant to, but if in doubt, please reach out. And of course, the most difficult thing is if someone we love or care about becomes ill, and I think that's affected most of us. So let me talk a little bit here about clinical syndromes that are important to keep aware of. One is, when is anxiety a significant problem? What we call generalized anxiety is characterized by persistent worry, feeling overwhelmed, worrying about everything. Something bad is going to happen. whatever is going to happen, things we used to be relaxed about, such as my family member is going to take a trip. Now we're anticipating what bad will happen. We're feeling more restless, irritable, on edge. There's frequently trouble sleeping, trouble concentrating. So that syndrome would be what we call generalized anxiety, which is pretty common and more so at this time, and it's helpable. Panic attacks are a different kind of anxiety. Basically, a panic attack is like a fire drill for something horrible happening to me. It's like feeling I'm having a heart attack or heart failure, but I'm not. It's just all of the fight or flight emergency responses without that. It feels as if something awful is happening. There's sweating, there's trembling, there's trouble catching my breath, my heart pounds. It starts without warning. We're not sure what triggers it. And we frequently restrict our activities, don't go out for fear we're going to trigger it again. So that's another kind of quite treatable anxiety, and both kinds are increased now. Clinical depression that responds to treatment, most often with talking to somebody, sometimes with medication, is characterized by decreased interest and enjoyment, changes in appetite or eating or weight, changes in our sleep. Some of us wake up early, some people sleep too much, changes in energy. Frequently, people don't have much energy when they feel depressed, difficulty concentrating, feeling more worthless or guilty, ruminating more, feeling hopeless, and when it gets serious, thoughts of death or even suicide. And that's a good reason to reach out to others for help. Now, an additional syndrome which happens is what we call complicated grief. Normal grief takes a long time, even if it's the most reasonable kind of grief, like I have an elderly relative who dies at 102. Even in that situation, grief can take a long time. A year would be common. But for many of us, there are difficult griefs where it lasts much longer and we have trouble getting out of the grief. It's a heightened state of mourning that interferes with being able to get better. There's pain, there's sorrow. We can't stop thinking about things. It interferes with our function day to day, and it's especially common with unexpected losses, which we're clearly seeing with COVID-19. And when the loss has to do with an intense, close relationship, it's more common. Another syndrome that we'll talk about more in a little bit is post-traumatic stress disorder. And clearly there are more people experiencing that, and certainly more people at the front lines are experiencing that now. I will mention that if people feel that they or somebody they love is at risk of suicide, if in doubt, do something. If I'm talking about dying or self-harm, it's best to take it seriously. Even if I say I'm joking, take it seriously, please. It's clearly correlated with more depression, anxiety, panic, being at loose ends, isolation, and often I might be drinking or self-medicating in some way. If there's a clear and present danger, it's best to call for urgent help like 911. It's much better to get the help than to take a chance. Other ways to get help. The clear thing that's been happening with COVID-19 is telemedicine. Most clinicians are trying to be available by telephone or by one of the video telephone programs to be connected with patients and family. Horizon has worked to make this easier, to help direct people to available sources of help. I'll mention briefly, and Chris will tell more about this. The Horizon Behavioral Health Care Navigation Team helps. The doctor and hospital finder helps. And it's easy to contact Horizon by telephone or on the web. In addition, there are many community crisis phone lines and emergency services that are available to be of help. If in doubt, please persist. Now, this is the general population we're talking about, although clearly, more of us are at risk at this difficult time. Those who have mental health concerns, either psychiatric diagnoses or substance use, or commonly both, have additional impacts. So moving to the next slide, here we have the plus. Clearly the social isolation is making things difficult. But in addition, we don't have a routine like we normally do. That's hard. Our sleep-wake cycles, our eating time, our usual, making sure I'm out of bed, I'm showered and dressed. That's different. And we're more separated from our support group. I can't go to a program or to my doctor in person or talk to my therapist in person or go to a support group. On the phone is helpful, but it's not quite the same thing. Clearly, if I've had surgery, I can talk to the doctor on the phone, but she can't examine me at a time like this. Or at least I'll speak for myself, many of us have difficulty asking for help or going to the hospital. And many of us worry, if I go to the hospital, will I get in contact with COVID-19? And we have seen that people with serious health problems like heart disease have stayed home instead of going to hospitals. That help. Hospitals are doing a great job. It's a difficult time, but they're working really hard to make sure that people with non-COVID health problems are getting taken care of as well. And fortunately, at least in this 3-state region, the numbers of COVID-19 seem to be going down. Common symptoms at this time include anxiety, depression for people who are vulnerable, having unrealistic plans, starting to think illogically. Some people will say, well, maybe I should stop my regular treatment, or maybe I should do something else instead. Sometimes people say, well, maybe I'll put my lithium carbonate away and just self-medicate with, say, cannabis, marijuana, which doesn't always work well. There are challenges in having this routine, in continuing to do self-care, in continuing to be physically active, and continuing to eat right. So once again, the focus is on outreach. Access to medications is a little more challenging right now. If you get it from mail order, it's slower right now. And many professionals are working extra hard to get medication to people. The pharmacies are working hard. I know that for people who need urgent medication, regulations have been relaxed some, so people can get medication-assisted treatment, say for opioid use, without some of the usual restrictions. There are problems with transportation. Some folks need help just ordering their medication, but I know that there's help out there, and if in doubt, please ask for it. Caregivers, that is the people who love somebody who has mental health or substance problems, need our support too, because it's a challenge. We love our family members who have struggles, but we also need care too. Caregivers often don't take enough time for themselves and don't do the self-care that really would be helpful. Now we'll switch here to people with pre-existing substance use problems who also have more impact. As we mentioned, no in-person support groups or self-help meetings, which is a big deal because we know that for most people with substance use, keeping active, having a schedule, doing something productive makes a big difference. It's harder to get prescription medicine and also substances of abuse. So some folks go into withdrawal, and then some folks go for a while without their usual their usual substance, and then some people will go and so
David,
again,
I don't want to, this is Angela, I don't want to interrupt you. We're losing you a little bit, so if you could just repeat what you last discussed.
Sure.
I think we lost your last comments.
Oh, I'm sorry. So basically what we're talking about is some of us won't have access if we have a substance of abuse to it. If we don't get it for a while, our tolerance may change. If I don't use opioids for a week, I'm going to lose my tolerance, sometimes even faster, and I'm more at risk for an overdose, especially in this time of high potency fentanyl. It may be hard to get my medicine, and we may need to enlist our health professionals to help us with that. And then sometimes people may be looking for treatment and the capacity may be more limited because treatment programs, especially residential ones, may be limited because of our social distancing right now. Let me just shift here for a second. Sorry, let me see if I can make this a little smaller. Well, let me say here that important things here include telemedicine, which can get people contact with medication-assisted treatment, which is really important to stay comfortable and to avoid relapse for people who use opioids. It's also of help for people who use alcohol. And then the important thing is staying in contact with other people early and often. And if in doubt, obviously we can call 12-step central groups, but also we can call places like Horizon and we can call our health professionals. If in doubt, like about overdoses, this is a time when we're trying not to be punitive. We're trying to get people help. Please call at this point. So let me move, if I could, to the next slide, please. Now, the general population, we've talked about people with illness, but for people on the front line, it's harder because even the folks at the grocery store, the truckers, all the people who are determined to be essential, the people I call, for assistance, they're trying to be helpful to all of us at the same time as this is stressful, and they're going through the same personal life problems as everybody else. Two additional issues are vicarious trauma. If I'm in the emergency room and I'm testing people and I'm seeing the people coming in ill, that can be pretty hard to take. I may be talking to a lot of frightened, sick people and their frightened families. We're trying to be patient and kind constantly. We're trying to be really great, but it's hard to do that continually. At some point, we need to take care of ourselves or we're gonna break down or just not be able to do it. Even the best people at some point need to take a break, need to do self-care, realize that we're getting impatient. And it's how do we care for ourselves at that point? Clearly, those of us who are in the helping fields feel like we should be able to do stuff. The shoulds are big, but self-care is important too. It's going to be basically self-kindness is going to be a big piece here. Making sure, if at all possible, to get enough sleep, adequate nutrition, enough time to vent with peers and supervisors, sometimes to talk to a therapist. It's really important that we, give people a chance to recover from stuff. Things can get to the point of post-traumatic stress, not just for caregivers, but for others as well. And post-traumatic stress deals with, I'll give you an overview of diagnosis. First is obviously, traumatic events. And those of us who've been through trauma in the past are more vulnerable to trauma in the present. Our psyches are designed to handle a certain amount of difficult events and trauma, but too many things in a lifetime or too many things at one time overloads even the best coping skills. With PTSD, post-traumatic stress disorder, there's re-experiencing of things that we've been through. It can be through what we call flashbacks when we're awake. It can be through dreams, and it can be repetitive and really, really emotionally powerful. It can be triggered by being in situations that were really hard. And for people who work in emergency services, things that remind us of really difficult things we witnessed can bring up symptoms. There may be avoidance, trying to avoid things and places that trigger some of these difficult feelings. People with trauma tend to have emotional lability, ups and downs, often feeling on high alert, intense, reacting strongly, sometimes breaking out in anger without really realizing what triggered us. In addition, many people with trauma are hard on themselves, feel like we're not good enough, we're not as good as other people who can handle all of this better. I don't think that other people handle it better, but that's how we feel. And if we have this combination of things, it's important to look for some help and support. And even the best people can have this kind of impact at this point. There definitely is help there. As you see on the slide, there's professionals who are, who Horizon can help line people up with. There are telemedicine programs, what we call trauma-informed care, where people have other things taken care of, but with sensitivity to the effects of the traumatic events that have influenced them. There are programs specifically for frontline and first responders, because this is a deal, New York City first, but now it's affecting the rest of the country. So let me move on from here, thank you. This talks about, all of the things that go with post-traumatic stress. It affects our concentration, flashbacks. It can affect veterans, but even veterans who didn't serve at the front. It affects, irritability, guilt, distress. This is a great expression of all the things we can go through and some of the things that can help us. Sometimes, I didn't mention it, but numbness can be something people experience with this, or a way of coping with this, just not to feel because it's so overwhelming. So may we move to the next slide, please. I'm not going to go in real detail on this, but let's just say that post-traumatic stress, which affects about 6% of the population at a given time, and probably more highly at times like this when people are exposed to extra things. It's a big deal. People who have experienced trauma are much more likely to self-harm. If you have to take one thing away, that's it. Much more likely to self-medicate with substances. The emotions can be so hard to tolerate. We use other things. It could be alcohol, it could be tobacco, it can be lots of other stuff. There's a pattern where people with PTSD seem to self-medicate with opioids commonly. Sometimes people with PTSD try to connect through intimacy with other people just to prove that we're still lovable, worth something. It doesn't permanently make things better, but we try. Clearly, depression is common with PTSD. Difficulty managing work is common. So there's a lot that goes with this. And if we see this pattern, please call for help. So let me move on from here, thank you, to the next slide. And now at this point, I'm going to turn it back over to Chris, who's done an amazing job here, and have her tell you more about healthcare resources that you can get through Horizon, and she'll tell you more at this time.
Thanks, David. Thanks for that overview of the impact of COVID-19 on, and it's so interesting to see that the general population is impacted in such a profound way, but then those who with mental health and substance use disorder have even more complications, as well as those on the front line. So David has said several times through his presentation to encourage people to reach out for help, and this slide tells you kind of where you can reach out for that help. Horizon covers over 3.5 million members in the state of New Jersey. If you have Horizon insurance, you should use that insurance card and the 800 number for member services to access care. There are behavioral health clinicians at Horizon who can help connect you to the services that you need. In addition, we wanted to highlight that there are 3 new medication-assisted treatment providers in the state of New Jersey to add to the complement of our existing provider network. And we raise these because these are MAT providers that are virtual. They can serve anyone, anywhere in the state of New Jersey virtually. So members who are struggling with opioid use disorder and alcohol use disorder can get help from these providers. Eleanor Health, Workit, and Caden Health. Caden is in the final stages of their contracting, but they'll be on board within the next week or 2. In addition to that, we have Able2 Community Support. Able2 is a partner of ours treating physical and behavioral health conditions, but they've added a special program called Community Support to provide additional resources for folks struggling with COVID-19. And this is a therapist intervention, it's a therapy intervention. So you can connect from the comfort of your home or your office or wherever you're sitting to a therapist who can help you deal with the anxiety and the symptoms that are accompanying the experience of living through COVID-19. And David mentioned that we're developing more behavioral health resources. Horizon is focusing on helping our provider network to continue delivering services even under social distancing rules. We'll be working with them over the coming weeks and months to talk about sustainable telemedicine solutions, some of the waivers and executive orders that were put in place to pivot our behavioral health system from in-person services to telehealth practically overnight. We expect that some of those will be rolled back and the providers will have to adapt to new protocols. We're looking to provide some support for them as they transition back to HIPAA compliant telemedicine. And we're also working with several providers throughout the state to develop trauma-informed care. Trauma-informed care is really about making sure that the treatment environment both mental health and substance use disorder is trauma informed, so that we're not triggering trauma by the way that we're interacting with members or how we're speaking with them, and perhaps even delivering some training on trauma-informed care, and developing more resources in the community to address post-traumatic stress disorder for members who have experienced firsthand COVID-19, either through their own illness or the illness or even the death of a loved one can be traumatic, but also for those frontline workers, frontline physical health, frontline behavioral health workers who have continued to work through the crisis, first responders, and the many categories of essential workers that have continued to be out in public and interacting with the threat of COVID-19 on a daily basis throughout the crisis. All of those circumstances can create a feeling of trauma and the need for some intervention. David said it throughout his presentation, when in doubt, call for help. And we want to communicate to all of you that Horizon is here to support our members in getting the care that they need. And with that, I think, Angela, we've probably gotten to the end of our presentation, so I am going to turn it over to you.
Thanks so much, Chris, and thank you to both you and David for that great presentation. We have some questions from our attendees. The first one kind of goes on what you were just discussing about different options. So the question is, does Horizon have insurance options for low income or no income individuals who are unable to pay premiums? And if not, can Horizon assist those individuals with finding options?
Well, Horizon covers both government and commercial lines of business. So folks who don't have the means to pay for their insurance can apply for Medicaid, and Horizon is one of the Medicaid managed care organizations that serves the population who's funded through Medicaid. In addition, Horizon does have products on the insurance exchange, so people can purchase insurance directly from the insurance exchange and access Horizon coverage there. And also through a more traditional employer group, when you get hired and the employer has Horizon insurance, then you can join the Horizon insurance that way. So those are the three ways that I'm aware of that folks can get Horizon insurance.
Thanks. And David, I think this question is geared to you, but Chris, you can obviously join in as well. But we'll start with David. Are there any mental health maintenance activities you would advise people to undertake to help get them through the inevitable stress of this crisis?
Well, there are several. Some of the things that are recommended are, and I won't give you all the details, mindfulness, which is a way of being able to be present with things without having to respond emotionally. It's like the opposite of don't just sit there, do something. It's just sit there, don't do something, just be present for what you're feeling without reacting. What goes along with this is frequently some of the relaxation techniques. For others of us, other things may help. Physical activity could be a great help as well. Having a routine can be a help. But for many of us, especially me, reaching out to others can be a really important time when I'm getting stressed out.
All right, great, thanks. Here's another question that we have. It's really more of a statement, but I'm in the outpatient field, and we cannot do drug testing. We're seeing more relapses, more relapse triggers. Any thoughts or advice on this?
I've seen some interesting work in drug testing, particularly with our new virtual providers, where the provider is actually sending one of the point of service drug collection cups to a member via mail. They're not obviously videotaping the collection of the urine screen, but they're having the member show the results to the video camera after they're done collecting their specimen. Very interesting. We're learning more about that as we get more connected with the virtual providers. It is difficult, but it's important to continue to deliver care no matter what. This is a good time to practice sort of a harm reduction model where you just continue to support the member even virtually until you can get back together with them in person. Delivering care no matter what their circumstances, whether they're using or not, encouraging them for higher levels of care if you think that's indicated.
Yeah, just to add, it's obviously a time where more folks have slips. The issue would be really just to how can we maintain a therapeutic relationship with these folks, and as possible, say, okay, this happens to people. How do we get back in gear again? How do we say, okay, stuff happens, but how do we get back and make the progress again?
All right, and adding on to that telehealth conversation, how effective do you believe the telehealth options can be in replacing the personal interaction with healthcare providers? And also, is there any data to show an increased use of telehealth during this pandemic?
I think my understanding is that there's been an increase in telehealth, but not as much as maybe we would have liked. I think there is definitely evidence that many people are happy with telehealth, or even, even getting therapeutic responses from a computer program, if you can imagine, like cognitive behavioral therapy. So it's not perfect, but it does meet the needs of many people, most people.
Yeah, and I would add to that, we have heard from many of our providers that they have seen an increase in compliance, in attendance, particularly, they had a lot of no-shows for first appointments previously, and that no-show rate has dropped significantly while they're using telemedicine. There are some groups, particularly adolescents, who seem to really embrace technology. IOP groups that used to be having near half attendance are nearly a full group, and the kids are interacting in a way that they haven't ever done in person. So we've definitely seen huge uptick in behavioral health telemedicine utilization because of COVID-19. We expect that we'll continue to see behavioral health telemedicine continue beyond the pandemic because we think it increases access to care and in some cases engagement to care.
Great. We're going to just pause here for a moment. I know we're coming to the end of our scheduled time. Our panelists are going to stay on to continue to address some of the questions that we haven't been able to get to. But in the meantime, on your screen, you will see a brief survey pop up. So I appreciate it if you could complete that. And I want to thank Chris and David for sharing their expertise today. And thank all of you who participated in joining this conversation to knock out opioid abuse. The Partnership for a Drug-Free New Jersey and the Horizon Foundation for New Jersey will be providing additional resources on the website knockoutopioidabuse.drugfreenj.org. And you can visit that site to learn about more information on upcoming webinars and other programs to fight the epidemic. Our next webinar will be held on June 11th. And if you go to the website, you can sign up for information on that. That will be the beginning of a series that we're launching with the Office of the Attorney General's NJ Cares program that will go throughout the summer, addressing different topics. We'll be following up with each of you with a list of resources as well as the survey if you're unable to complete it, and for additional information. And we thank you again for committing to be part of the solution to New Jersey's opiate crisis. So on behalf of Horizon Blue Cross Blue Shield of New Jersey and the Partnership for a Drug-Free New Jersey, we wish you continued good health. Be well.